जंगी आलात इस्तेमाल कर रहे हैं ये लोग।
Assalamualaikum everyone, this is Hamza Hussain and a very warm welcome to all of you in Pakistan Cardiac Super League Season 2, presented by Pakistan Cardiac Society and powered by Wilson's Pharmaceuticals. Today we are excited to bring you the live action of a sixth match, which is between the semi-finalists of the Season 1 P.I.C Warriors versus new entering team S.I.C.V.D Thunders. Like always, before diving into the excitement of the match, allow me to introduce the expert senior faculty members who have graced us with us today with their presence. Today we have with us Professor Mohammad Ishaq. He will be the match umpire of today's match. He is a distinguished cardiologist at Karachi Institute of Heart Disease and he will be joining all the way from the UK. Professor Ishaq has been a regular participant of this season and his dedication and unwavering support has been instrumental in the success of this league. And secondly, for the first time ever in the history of Pakistan Cardiac Super League, we are honored to have with us one of the highly qualified cardiologists of Pakistan, a revered figure for all the aspiring cardiologists, an icon and a pride of Pakistan, Professor Hafizullah. Professor Hafizullah has serving as a chairman of the board of governors at Peshawar Institute of Cardiology, and we are very much and deeply honored and grateful to Professor Hafizullah for becoming part of season 2 of Pakistan Cardiac Super League. And on the other hand, we have also with us Professor Fawad Farooq Saab. Professor Farooq Saab is General Secretary of Pakistan Cardiac Society and also Professor of Cardiology at S.I.C.V.D Karachi. And along with him, Professor Abdul Hamid Siddiqui Saab. Professor Abdul Hamid Siddiqui Saab is former Professor of Cardiology at Armed Forces Institute of Cardiology, and he will also be the umpire of today's match. And we have also with us Professor Dr. Iftikhar Ahmed Saab. He is Professor, Associate Professor of Cardiology at S.I.C.V.D, and he is also the mentor of S.I.C.V.D Thunders. And we also have with us Professor Bilal Akhtar Saab. He is Assistant Professor of Cardiology at S.I.C.V.D, and he is a team coach of S.I.C.V.D Thunders. And last but not the least, I would like to introduce the moderator of today's program, Dr. Hamza Gauri. Dr. Hamza Gauri is Assistant Professor of Cardiology at Rawalpindi Institute of Cardiology. And without further ado, I would hand over the microphone towards Dr. Hamza Gauri to formally start the proceeding of today's match. So over to Dr. Hamza Gauri, sir.
Thank you very much, Hamza. Assalamu alaikum to all of you, and I welcome you to the second season of Pakistan Cardiac Super League, which is working in collaboration with Pakistan Cardiac Society and Wilson's Pharmaceutical. Indeed, it's a wonderful season, and we've already seen some very close matches which have actually gone to the wire. Now, I'm hoping again today in this very interesting game between the two teams, as we all know that we have our S.I.C.V.D. Sindh Institute of Cardiovascular Diseases Thunders versus Peshawar Institute of Cardiology Warriors as we unfold today's game. But before we move on, I would like to move on to the dignitaries, and I welcome the chairpersons for the match. We are really happy and excited to have Professor Hafizullah with us. Welcome, sir. We have Professor Fawad Farooq, as usual. I think he's been instrumental. We have Associate Professor Iftikhar Ahmed Saab. He's the mentor of S.I.C.V.D. We have Professor Feroz Maiman. He's with us as well. We have a long list of dignitaries I think we are going to unfold as we move on, and we are all extremely grateful for their presence. And last but definitely not the least, as we always say, that it's our umpires which are always there, and they hold the key to a lot of the questions and the eventualities. So I do welcome Professor Muhammad Ishaq Saab. So it's great to have you as an umpire. And we also have Professor Abdul Hamid Siddiqui Saab. So I think I would now move on to the next phase, and that is the two teams. And I would like the captains to give the introductions of their teams. First, we move on to P.I.C. Warriors. So please, can we have the introductions?
Assalamu alaikum. This is me, Dr. Usman Khanzeb, second year PGR cardiology at Peshawar Institute of Cardiology. On my left side, this is Dr. Ataul Wadood, which is first year PGR cardiology. And on my right side, this is Dr. Hikmatyar, second year PGR cardiology at P.I.C.
Well, wonderful. I welcome you, and I think we're going to have a good match. So best of luck to you. So with this, I move on to S.I.C.V.D. Thunders. And can we have the introduction from the captain?
Assalamu alaikum. My name is Dr. Rabi Harouch, and I'm captain of the team. On the right side, she's Dr. Ilham. She's R3 resident, and she's Dr. Kanchan. She's a R2 resident. And on the left side of my hand is she's Dr. Kinza, and she's R2 resident.
All right then. So best of luck to you for the game today. And as we all know, we now move on to the toss, and it's going to be an electronic coin toss. So can we have the coin toss? Is it ready? All right. So I'll randomly ask one of the teams. So as we have S.I.C.V.D. Thunders, please go ahead. What would you pick? Heads or tails?
Heads.
So it's a heads. Let's see what we get. Oh, so the news from the center is that it's tails. So yes, P.I.C. Warriors, they have won the toss. So we'll start off with two questions. And the first question is, P.I.C., do you want to take the questions or you want to throw the questions?
We want to take the questions.
All right, so they want to take the questions. And the second question to you, you've got two options, A or B, two veneers, two scenarios. Which one do you want to pick for yourself? A or B? Which case?
B, sir.
All right, so they have picked case B. That means we're going to start with the scenario B. All right, so we have the scenario on the screen.
Okay.
So please start reading the scenario. Yes, go ahead, please.
A 20-year-old girl presented to OPD with complaints of dyspnea, NYHA class 3 for the last 1 week. She had history of upper respiratory tract infection 1 month ago and lives with her parents and 5 of her siblings in an underlived area. She also complains of pain in multiple upper and lower limb joints. On examination, her heart rate is 100 breaths per minute. Blood pressure is 100 by 60 millimeter of mercury, and saturation is 93% at room air. Her temperature is 38 degrees Celsius. Chest examination reveals basal crepitation, while cardiac auscultation reveals a pan-systolic murmur at the apex, along with a mid-diastolic murmur. There is no evidence of joint swelling. Her ESR is 30 mm per hour.
All right, so I'm going to give P.I.C. Warriors a couple of seconds. So just let us know when you are ready.
Ready?
Okay, so can we have the first question on the screen, please? Thunders, read the question as you have it on the screen.
So first question is, how many major and minor Jones criteria is the patient fulfilling? Alpha, 1 major plus 4 minor. Bravo, 2 major plus 2 minor. Charlie, 2 major. Delta, 1 major plus 3 minor. And Echo, 4 minor.
All right, so
Excuse me,
60
the
seconds
screen
start
is
now.
not clear, sir.
What?
Screen is not clear, sir.
Screen is okay. Hold the timer, please. You can't see the screen?
No, sir.
Okay, so the technical team, please look into it. We're going to hold.
Pneumatic there.
Jones criteria.
Scenario.
Can you see it now?
No, sir.
All right, so the team is
black.
working on it. So is it distorted on your screen or you don't see the screen at all?
Or no screen at all?
No screen at all, technical team.
Sir, the question is here, but still it is blurred, sir, not clear too. We can't see the clearly.
So it's blurred, okay.
It's clear now.
Okay,
No,
so
sir.
there may be a
It's clear to me.
technical internet issue. So I think so our experts can see the screen clearly, right? Is that true, sir?
I think
Yes, I can see it very
I think
clearly.
they want scenario. They want scenario possibly.
Or do you want the scenario? Do you want the scenario?
Yes, well.
Now it is clear, sir.
Okay, it's
Okay.
clear.
Then
So
go
should-
ahead then, please.
Okay,
I think
please
we
start the
start-
timer. Start the timer, please.
Can we see the scenario, please?
Okay, scenario, please. Show the scenario quickly.
Joint erythema originatum. Okay, sir. Move.
Okay, show the options. 20 seconds. Come on.
2 major plus 2 minor. 2 major B. B. B.
5 seconds.
Sir,
Come on.
option B.
B for ball.
Sir, option B. B for ball, sir.
So
B.
they want us to lock the option B, please. Lock it. Yes. Well done. So that's, although got a bit tricky, but I think a good answer. Well done. It's a good start. So that's a straight 6. Okay. Next question. Question number 2 on your screen.
Second question, which of the following would be an evidence of proceeding streptococcal infection in the patient? Alpha, ASO titer more than 200. Bravo,
Sir, it is blur. Sir, it is blur now. Clear now, clear.
Okay. Please go ahead.
Bravo.
Start the timer.
more than 1.54
hold on.
rise in titers between acute and the convalescent samples.
Right.
Charlie, more than 2-fold rise in titers between acute and the convalescent samples. Delta, both A and B, and Echo, both A and C.
All right. Timer is on now. I hope you can see it now.
Yes, sir. It is clear.
Okay. Approaching 20 seconds.
1.5 fold than it. 2 fold.
15 seconds.
2 fold. A and C data.
10 seconds. Come on, hurry up.
Sir, option E, epsilon.
Option
Proteins.
E. Lock option E then. Very well done. Well played. Another 6. That's a lofted stroke over the boundary. Good one. Well done. You seem to be, although slowly, steadily, you're doing a good job. So let's have the third question on the screen.
Sir, screen is blurred now again.
Okay, just hold the timer. Please read the question.
I can't. Okay. Which of the following manifestation of rheumatic fever is more common amongst female? Alpha, arthritis. Bravo, erythema marginatum. Charlie, subcutaneous nodules. Delta, Sydenham's chorea. And epsilon, carditis.
So can you read it? Is it clear, the screen? Warriors, are you there? Please hold the timer. Hold the
Yes.
timer.
That's why.
Yes, sir. Yes, sir.
Okay,
But-
please. Yes. Okay, continue then. Okay, so I would request both the teams, especially the ones who are answering, not to switch off the mic. We want to hear you discussing.
Yeah,
Oh. Yeah, arthritis most common manifestation. Yeah, I think.
20 seconds. Eight, seven. Hurry
Sir,
up.
sir, option A, sir, arthritis.
Option A. Lock option A then. Oh, that's the first mistake of the day. Never mind. You really got close. Turns out it was an outswinger. So, never mind. The first one. So, can we have the next question? Question number 4. Read, please.
All of the following are required
Screen
for
is blurred,
establishing.
sir. Screen
Okay,
is
so
not
they
clear,
can't.
sir.
I think they have some
All of the
technical
following are
internet
required
issue
for
going on.
establishing Doppler echocardiographic rheumatic mitral valve valvulitis, except alpha seen in at least 2 views. Bravo, jet length is more than 2 centimeter in at least 1 view. Charlie, peak velocity is more than 3 meter per second. Delta, peak velocity is more than 4 meter per second. And epsilon, pansystolic jet in at least 1 view.
Okay, the timer starts now.
Sir, screen is still blurred. Not
Okay,
clear.
hold the timer. They can't see the screens. We definitely have some internet issue going on in their region, I think. So let us know when you can read it.
Now it is clear, sir.
Okay, so please start the timer. All right, 50 seconds. So I apologize for this technical glitch on behalf of the team, but they are working on it.
Jet length more than 2 peak velocity. Let's see. The jet length more than.
20 seconds. Okay, 10 seconds. Come on. 6.
Sir, option B, bravo.
Option B, bravo. So lock option B, please. Oh, so it turns out a streak of 2 wrong answers. Okay, never mind. I think you need to buckle up for the next one. All right. So can we have the next question? Question number 4 on your screen. Question number 5 it is.
Regarding rheumatic mitral stenosis, which of the following are characteristic M mode findings? Alpha, flattening of EF slope. Bravo, absent A wave. Charlie, parallel motion of the posterior mitral leaflet. Delta, both A and B. And epsilon, both A and C.
Right. So timer starts now. So it's the halfway mark. Extremely important, this question.
Absent A wave, oblique, the parallel motion.
Approaching 20 seconds.
EF flat of EF slope. EF slope कम नहीं होगा.
All right. 10 seconds. 7. Come on. 5. Answer.
Sir, option E epsilon.
Okay, just at the last moment. I think it was just the final second. Option E. Lock option E, please. Oh, wonderful. I think we thought you had missed it. Well done. A great stroke in the end. Over for a 6. So halfway mark, and you've got 3 correct answers. Well done. Score is 18. And with this, we move to our question number 6. Read, please.
Histologically, which of the following is the hallmark of rheumatic carditis? Alpha, Eschhoff nodules, Bravo, McKinnon plaques, Charlie, asteroids bodies, and Delta both A and B, and Epsilon both A and C.
All right, your timer starts now. So there's a slight twist here, S.I.C.V.D Thunder. I will also request you to give me the answer once we are done with the answer from P.I.C Warriors, just to see.
Sir, option D, delta, both A and B.
All right, that was very quick. I think they have come down the wicket. Are you ready? You really want me to lock it?
Yes, sir.
Option D, delta. Right? Okay.
Yes, sir.
All right. So S.I.C.V.D, what's your answer?
D.
Okay, you want to go with D as well. All right, good. So, is it true? Can we have the answer? Oh,
Oh,
wow. That is a very interesting result. So, it's the wrong answer. B was correct. So, very interesting. I think they were following the other team. Makes it really interesting. Anyhow, can we have the next question, please? Question number 7 on your screen, please.
During endomyocardial biopsy, what is the predominant location of the Eschhoff bodies in rheumatic carditis? Alpha, interventricular septum, Bravo, mitral valve, Charlie, RV free wall, Delta, aortic valve, and the Epsilon, none of the above.
And 60 seconds start now.
My advice, please don't rush to the conclusion. Take your time.
I think this is a very important advice and you must pay heed. Players.
endocardium की असल के endocardium की Eschhoff nodule जगह की गई endocardium mitral valve.
Approaching 20 seconds.
Like
10 seconds. Come on, Warriors. 7.
Option
Answer.
B, Bravo.
Option B. So lock option B, please. Oh, so that was an inducker. I thought it would be a straighter one for you and you would hit that out of the park. But anyhow, never mind. You really have to pick up the pace now. Just have 3 more questions to go. Let's have question number 8. Read the question, please.
In rheumatic heart disease, which of the following is the most common ECG findings? Alpha, PR prolongation, Bravo, sinus bradycardia, Charlie, QT prolongation, Delta, low voltage QRS complexes, and Epsilon, electrical alternance.
And 60 seconds, start now.
Prolongation, okay. Sinus bradycardia. لأن أصل كده غبي.
mother is here. 8. Now,
Option A, PR prolongation, sir, alpha.
Okay. You want me to lock which option? A?
Option A.
All
alpha.
right. So lock option A, PR prolongation. Yes, very well done. I think this has been flicked for a 6 and a much needed boundary, I would say. You definitely had to score on this one to put up a reasonable total. Well done. And with this, we move to the next question.
Sir, screen is blur.
Okay, just hold the timer and let us know when you can see the screen clearly.
Should I stop?
Okay, please read the question.
Still it is not. Still it is blur, sir.
Okay, so the technical team is on it.
Secondary prevention introduces.
So I think you should start reading the question, please. S.I.C.V.D. Thunders.
Based upon the Jones criteria and echocardiographic findings, including severe rheumatic MR, the patient is diagnosed with rheumatic heart disease. What should be the schedule of the secondary prevention? Alpha, injection benzathine penicillin 1.2 million unit every 4 weeks. Bravo, injection benzathine penicillin 6 lakh units every 4 weeks. Charlie, injection benzathine penicillin 1.2 million unit every 30 days. Delta, injection benzathine penicillin 1.2 million unit every 3 weeks. And Epsilon, injection benzathine penicillin 6 lakh unit every 3 weeks.
And 60 seconds on your screen.
Duration 4 weeks. 4 weeks. 4 weeks. Every 4 weeks.
So again, I would request S.I.C.V.D. Thunders to also give their answer in the end.
30 days.
ورقي كلمات سونا يعني بينه 4 weeks وما
30 days. 30 days. 4.2.
All right, we are all excited for the answer.
3 weeks. Near about it. No, 3 weeks. 1.2.
20 seconds.
1.2 every 3 weeks. Which is and the 4 weeks, 4 weeks, or every 2 days. Actually, from the same.
6 seconds, come on, hurry up. 3.
Option A, sir.
Option A.
Option A, Epsilon.
Option A for alpha, right?
Yes, sir.
Option A for alpha. This is their option. This is what they want us to lock. S.I.C.V.D. Thunders. What's your opinion?
Delta.
So you're going to go with Delta. All right. Let's see. Can we have the answer? Oh, seems like Thunders were right. I thought this was a full toss. Whoa. Interesting one. So makes it very interesting. I think well played. Well. Warriors, come on. You need to pick up the pace on the next one, which is the last question. Question number 10 on your screen.
The patient states that
Sir, screen is blurred.
Okay, hold on, please. Can you see it now? Okay, please read the question.
The patient states that she can't tolerate injection benzathine penicillin as it's very painful. What should be the next mode of action with regards to secondary prevention? Alpha, stop secondary prophylaxis. Bravo, replace benzathine penicillin with penicillin B. Charlie, replace benzathine penicillin with erythromycin. Delta, replace benzathine penicillin with azithromycin. And Epsilon, none of the above.
And 60 seconds, start now.
Alex is what stop. Picture. Second, in penicillin with penicillin V. That's the connection. Third, erythromycin. Mama plus
Come on, Warriors, you can do it. Very important to get this one right.
C, CT. C with O.
Option C, sir. Charlie.
Option C. You want me to lock option C? Are you sure? Last question.
Yes, sir. Yes, sir.
Okay. Lock option C. Oh. Whoa, that was a quick delivery, and I thought you'd be able to fend it off, but it's a miss. Okay. So, with this, we now come to the end of the first innings. And as we know, P.I.C. Warriors have scored 24. So, 4 right, 4 correct answers. And with this, I think we have come to the first half, the end of the first half. And I would now request our dignitaries, and I will start with the panel expert, Dr. Feroz Memon Saab. Sir, can we have your input? What do you see?
Sir, thank you very much. It's a wonderful competition. I was pleasure to see Professor Hafizullah after a long time. Hafizullah, welcome, sir. Assalamu alaikum. It's a really wonderful program. Fawaz is always there. और मेरा ख्याल है it's a very healthy competition among the Fijis. It enhances their knowledge and especially our knowledge as well. So thank you very much, Wilson, for this wonderful program and show. I say it should go on. Thank you very much.
Thank you very much, sir, for your extremely important input. And with this, straight away, I will move towards Professor Hafizullah Saab. It's great to have you. Sir.
Yeah, thank you. I think this question number 6, the answer perhaps is not very clear. The 6 S.I.C.V.D bodies are characteristics of rheumatic fever. So I think that perhaps answer needs to be rechecked before you finalize it. So I will ask the umpire to look into Google checkup quickly, and he can probably share the answer with us later on. But question number 6 answer does not seem correct to me.
Okay, sir, I think fine observation. So I'll request the umpires.
Excuse me.
Sir, please. Dr. Feroz.
So I think whenever there's a wrong answer, the answer is wrong, we must know the right answer so that the team has the chance to claim any controversy or anything in their mind, so that the referee and umpire can play their role.
Right, sir. I think
sir,
great input.
Sir, yes. we have actually, sir, made an answer D, and it has been mentioned C over here.
So there has been a mistake in the options. We actually chose option D.
Yes, I think they chose option,
which is A and B.
Yes, A and B. That's what they chose. Option D.
Sir, can I say something?
Yes, please.
क्वेश्चन में हिस्टोलॉजिकल है, तो जो एश ऑफ नोड्यूल्स हैं ये हमें क्लिनिकली मिलते हैं या हिस्टोलॉजिकल मिलते हैं, क्योंकि यहाँ पे हिस्टोलॉजिकल का ऑप्शन है.
Histological,
yes, that's what's clearly mentioned.
It is also
that's in the heart, only when you see in the histology, the ones you're referring are rheumatic nodules, which is different thing altogether. That's clinical. So let the umpire look at it. I just sort of wanted to make it absolutely clear. So there is no...
Very right, sir. We have the panel of umpires. We have Professor S.I.C.V.D Saab, he's there, and Professor Abdul Hamid Siddiqui. And I also see Fawad Saab there. Sir, any one of you, please.
One thing which we have decided...
Thank you very much.
Yeah, Dr. Saab, usually, I just want to add one thing. Usually we have decided that if you have anything to challenge, usually we can't answer at that particular moment regarding that. You can submit, it can be assessed, and let's see the second inning. Don't hold the things right now. If this question really making a difference in win or loss, then we can rearrange the match if this question turn out to be like not correct or anything. So rather than holding the match, continue with it. Consider the let's see how the umpire decides. That's what our notion is in that sense. Whenever there is a controversy, it should be addressed, but not holding the match together for that reason.
Of course, we don't want to hold the match. The match should continue, but let's look at the answer correctly so that it is important for the sanctity of our knowledge and as such. Right. Let's continue.
Completely agree.
Very right, sir. The umpires, please. Sir.
Thank you very much. I think, first of all, let me welcome Professor Fizullah Sahib and pay my regards to him. I have seen him
Thank you.
after a long time. Sir, Assalamu alaikum.
Assalamu alaikum,
Acha, sir,
sir.
each time we have one or two questions, at least one question each time we have, in which we think the answer is A and actually it is B or C. And I agree with Professor Fizullah that all these controversial questions should be supported by some evidence. So going through the review, there's always a reference from either a textbook or some other article to support the answer. But I think I agree with Fawad. Let's continue with the match, and all the disputed, if any team has a dispute about a question, we can provide the references जिन्होंने ये formulate किए questions. So I think there's always one question where we think that this is their correct answer and it turns out to be the wrong answer. So we can come to that solution later on. But let's continue with the match. I think this was a question was quite a straightforward and something very common in our country, rheumatic heart disease. And I think the answers were also not difficult, not tricky. And I think in all fairness, we should just continue and see what the other team scores.
Very right, sir. I think it's I think very important input from Professor Hafizullah Saab. I think he's absolutely right, and I also agree with the rest of the panel, along with the umpires, that we need to continue. And there is a review committee.
Just a short comment.
Sir, please.
I think we can decide it in the end, but just a short
Yes.
comment. I've just checked on the Google that histological is Ashoff bodies and this McCallum plaque is non-histological. I think we can confirm in the end again.
Right, sir. What we'll do is, once I think now that it's been checked, in the end we'll reconfirm it. There are always there is a review available, and we have the references, and then the point can be awarded in the end. So I think in the end we'll conclude this. So if now the experts they allow us, we can move to the second half. Should we, sir?
Please carry on. Carry on. Everybody quiet and carry on.
Thank you very much, sir, for your wonderful input. Great to see the stalwarts with us today, and we are extremely excited. So with this, we move to the next innings, the second half of the game. So it's S.I.C.V.D. Thunder's turn, and I would request P.I.C. Warriors to please read the Vinay.
A 35-year-old lady, known case of SLE and a non-Hodgkin lymphoma, present to OPD with a complaint of right leg swelling. The patient has been on chemotherapy for her non-Hodgkin lymphoma for the last 4 months. On examination, her heart rate was 110 per minute, regular. Blood pressure was 110/60. Chest examination and cardiac auscultation were normal. Examination of the lower limb showed tender erythematous swelling of the right calf along with unilateral pitting edema.
Okay, so Thunders, you can take a few seconds to go through the scenario and let us know.
I would suggest you can write salient points with you so that you don't have to see this scenario again and again. You can keep those salient points in your minds.
Extremely important suggestion, I think, for all the team members.
Okay, move on to questions.
Okay, can we have the first question on the screen? Here you go. Read the question, please, Warriors.
What is the pre-test probability of DVT as per well score for a DVT? Alpha 1, Bravo 2, C3, D4, and E5.
And the timer starts now.
And you can see the scenario again if you want to.
Swelling है तो उसके 2 points होते हैं.
Score to beat is 24. Approaching 20 seconds. 10 seconds.
Okay, epsilon 5.
So, option E. Please lock option E. Oh, that was, I thought, it came straight on to the bat, but I think they've missed this one. Never mind. You still have 9 more questions. And the score is 24, which you have to beat. Question number 2 on your screen.
Based upon the pre-test probability of DVT, which is the next best investigation that should be carried out? A. Venogram, B. Duplex ultrasonography, C. D-dimers, MR venous imaging, and E. None of the above.
And 60 seconds on your screen.
Yeah.
20 seconds.
Okay, we'll go for alpha.
Option A. Is that correct? So they want to go with option A, which is the venogram. All right, lock the option A. Oh, another one. Getting the better of them, but I think, okay, well, never mind. You still have
I think
8
they're
more.
confused. They're missing full tosses.
Very right, sir. Yes, I think they have to buckle up. 8 more questions to go, and the score is 24 to beat. Come on, question number 3 on your screen now.
Decision to proceed with the duplex ultrasonography is done based on the high well score. What findings are expected on ultrasonography study? Sir, the screen is blurred, sir, so we can't see the options. So that.
Okay,
Hamza,
just
you
hold
can
on.
read the questions because they may be having problems with reading.
Now it is clear. Now it is clear. Option A, non-compressible vein.
Okay.
B,
Go ahead.
hypoechoic luminal shadowing. Option C, hyperechoic luminal shadowing. Option D, both A and B. And option E, A and C.
All right, 60 seconds on your screen, please. So I would request the warriors to be ready with their answer also.
Hyperechoic shadows होते हैं, clouds are seen hyperechoic, fluid is seen hyperechoic. हाँ, नहीं, if you see fluid, it's hypoechoic on ultrasound. Echo में ये पूरा cloud दिखता है, तो that is hyperechoic.
20 seconds. Come on. Come on, Thunder. We
Epsilon.
want to see you on the screen. Yes. What's the answer?
Epsilon.
Option E. Both A and C, they want us to lock this. But before that, I'm going to ask the warriors, P.I.C. warriors, what would you have picked?
Sir, option D.
They would have gone with option D. All right. They have picked E. Let's see. What is the correct answer? Oh, so yes, the warriors, they were right. Oh, goodness. So we've missed 3 questions on a trot. Well.
Hamza, can I make a point?
Sure, sir. Please.
I don't think we have had this practice in the past of asking the other team. So I think let's not do that. Keep it a secret. Because we didn't practice this before. So what do you think, Fawaz? I don't think it's a right thing to do.
Right, sir. I think you're, as an umpire, it's important, but this was something that they wanted to try out. But I think the umpires are there and we have to listen to the umpires for sure.
Yes, I think since we are doing something with a standard pattern, Ideally, it's no any harm in that, but since it's out of pattern, so would
Yeah.
stick to the pattern as agree by with Professor Saab.
Very right, sir.
But
Point
I
well
think,
taken. I think we'll
yeah,
continue.
but I think this is
Ji.
adding a new dimension to it, which is
Hamza.
very nice because we know that if one team is not answering, the other team is answering. So I don't see any harm to it because it is not affecting the eventual marks scored by any team. So I mean, and it is adding a new thrill to it. So I think perhaps it's a new trend that we also used it in FIT as well, so that we know that how much the other team knows, or is it a genuine sort of an answer or
तो
not.
कौन सा करेक्ट है इसमें?
Very right, sir. I think extremely important input. It's just that we wanted to add some more excitement, and these were just trial
Yeah.
questions. So I think the panel can have the decision on it later on, but let's just move on with the game for today. Okay, so can we have the next question, question number 4 on the screen?
Given the patient history, which anticoagulant would be the most preferred? Option A, warfarin. B, fondaparinux. C, low molecular weight heparin. Option D, unfractionated heparin. Option E, rivaroxaban.
And your 60 seconds start now. I would also request our worthy panel members and all the other people other than the team that is answering to please mute your mics. We can hear a lot of crosstalk. Come on, Thunder. We are all actually hoping for a 6.
C or D.
15 seconds. 10 seconds. Come on, we need an answer. 5. Answer. 1.
C. Charlie.
Oh goodness. So I think I will have to request the umpires here because we are not sure whether they were able to answer within the given time. Sir, our umpires, please.
I think we'll accept.
Let's accept, yeah.
Okay, so
We'll accept that.
Right, sir. So let's accept the answer. Which option do you want? Option number C, right?
C.
All right. Lock option number C. And yes, finally we are on the board. Well done, well played. But I think you really need at least 4 more answers to win. So come on. It's a good game. Let's see. We may just have a close game in the end. So can we have the next question? Question number 5 on the screen, please.
The patient remains admitted. His oxygen saturation intermittently falls to 90% at room air, and patient becomes tachypneic and tachycardic. Which investigation is most appropriate at this time to establish the diagnosis? Option A, ECG. Option B, chest X-ray. Option C, CTPA. Option D, DTPA scan. Option E, ABGs.
Okay, 60 seconds on your screen.
Just pregnancy. And this time we will date and this time involves some water crack. CTK diagnosis. Most appropriately is what we mentioned of initial pushta initial go for initial it's CTPA.
Okay, it's Charlie, CTPA.
All right, so you are sure about that? You want me to lock it?
Yes. Yes.
Okay, they want us to lock option C. Lock it, please. Yes. Very well done. Good discussion there, and I think you were very sure right from the outset. Well done. Well played. It's getting tighter. I think we are getting down to the wire. Can we have question number 6 on the screen, please?
Which of the following is the most sensitive finding on ECG with regard to pulmonary embolism? Option A, S1Q3T3. Option B, sinus tachycardia. Option C, RBB. Option D, electrical alternance. Option E, none of the above.
And your time starts now.
Common finding और एक है most specific sensitive finding. Most common sinus tachycardia. लेकिन उन्होंने most sensitive पूछा हुआ है. No, the common is the sensitive one. Specific one can be sensitive tachycardia. The common one is the sensitive one. The more is sensitive, the more common it is. C, D, E, B, A or B. S1Q3, T3 are not the commonest. Commonest sinus taking most common है. Most sensitive. यार फिर वो कहते हैं most specific तो फिर S1Q3 होता है और वो common भी नहीं है.
20 seconds. Come on, 10 seconds. Yes. Yes, please.
It's Bravo sinus tachycardia.
All right. So it's option B. They want us to lock option B. Lock option B, please. Oh, yes. Very well done. Great. So 3 in a row, that is. Wow. Slow and steady. They just, that's what they say. They win the race. Yeah. Good job.
Hamza, give me 30 seconds. We are on question 6. Regarding the previous scenario and question 6 that was answered by P.I.C.
Sir.
I have checked with the author of the question and that was a mistake. Their answer D was correct.
All right. That's,
so I want to give my verdict that 6 numbers should be added to the P.I.C. warriors because I checked with the author and there has been a mistake. So their answer D was correct and I would like that they should be given the numbers if there's no disagreement by other authors or anybody else. I think in fairness they should get the 6 marks. Because I'll be leaving a bit early, right on time. I've got another webinar. So I think this is my sort of decision.
Sure, sir. So I would request the panel.
I think we should honor umpire's decision. And that also is logical and sort of thing. And I'm very happy even the team B sort of answered the same question. They will not get the marks, but there is a congruity of thought from both sides. So for the sanctity of having to know the correct answer, I think it is important that we should take that as a proper answer.
Thank you very much, sir. Thank you very much. I was very upset and I thought I should make it clear. So thank you for accepting the verdict.
Thank you very much, sir. So with this, I think now we have the conclusion on that question straight from our panel of experts and the umpire. That's why we have the umpires. Very nicely done. Great job by the umpires, I would say. And with this, we add 6 more runs and that would make their score 30 now. So 30 is the score to beat. And with this, I think we've already had 3 6s on a trot. Let's have the next question on the screen, please. Yes.
The patient undergoes an ABG's test as a part of our workup. What findings are expected? Sir, the options are not clear, sir. Please.
Okay, so I will go through the options. Option A is respiratory alkalosis. Option B is raised A capital A gradient, small a gradient. C, decreased A to A gradient. Both A and B, both A and C is the option E. So the timer starts now.
A है no, it should be decrease gradient. Angular or arterial gradient.
Approaching 20 seconds. So I hope they know what AA gradient means. I'm hoping for that. Option. Come on. We need an option. 7 seconds.
Okay, it's delta. Yes. It's delta.
Okay, so option D, delta, both A and B. Lock option D, please. Oh, yes. That is the correct answer. Yes, I thought the technical team almost bamboozled me also. I thought that it was clear, option D. Well done, very well done. So I had a scare, I think everyone did. So well done, very well played. So we have another one, another 6, 4 on a trot. Good, it's getting interesting. If you get all the questions right, I think the Thunders can win the game today. Well done. Question number 8 on the screen.
The patient chest X-ray shows an enlarged right inferior pulmonary artery. What is the sign of pulmonary embolism called? Option A, pallet sign. Option B, Western mark sign. Option C, Hampton's hump. Option D, pulmonary oligemia. And option E, Schrödinger sign.
And the timer starts now.
Inferior pulmonary artery. We have done nicely. What am I saying? B, I think so. I think so. What am I saying? Just Hampton Hump now. Hampton Hump is vegetable possible. So it's not the blood वो इन्फाक्ट में करा रही है. उसमें inferior pulmonary artery enlarged करा रही है. What am I saying?
20 seconds.
Hampton Hump veg है. ये तो veg में इसमें veg नहीं है.
Are they going to tie the score? Let's see. 10 seconds now. Come on, answer.
C. No, it's not C.
Which option?
C. C. Charlie.
Option C, Hampton's hump. Lock option C, please. Oh, well. This one, yes, it was an inducker. You got it wrong. Beat the inside edge, as I would say. But still, we've missed the ball. Anyhow, so can we have the next question?
Needed 2 6s on 2 balls.
It's getting tighter, as I told you. I could see another game getting to the wire. So, your next question on your screen now.
As per the original version of the pulmonary embolism severity index, P.I.C score, which of the following variable has the highest weightage? Sir, option can't be read.
Okay, so option A, altered mental status. Option B, heart rate of more than 110 per minute. Option C, systolic blood pressure of less than 100 millimeter of mercury. Option D, chronic pulmonary failure. Option E, chronic heart failure. And the timer starts now. Approaching 20 seconds. Come on, Thunder. 15. 10. Come on. Answer. 5.
Okay.
Quick. Which one?
Bravo.
Okay,
Bravo.
so it's option B, heart rate of more than 110 per minute. Lock option B, please. Oh, goodness. Oh, so It was a bouncer, they hooked it and missed it. Oh goodness. So we've just got one more question to go and they can still tie the game. I think again we've got an extremely important last question. Moving on to the last question of the day. Question number 10 on your screen.
Based upon the patient evaluation, she has a PACI score of class 3. Sir, it is not clear. Sir, can you read it?
Okay, based upon patient's evaluation, she has a PESI score of class 3 and has evidence of RV dysfunction on the echo and CTPA. What should be the treatment plan? Option A, admission and anticoagulation. Option B, admission, close observation and anticoagulation. Option C, admission, close observation, anticoagulation and consideration of rescue reperfusion. Option D, discharge on NOACs and early follow-up. And option E, discharge and NOACs with routine follow-up, and the timer starts now. So let's see, is it going to be a tie or the Warriors are going to take it? 20 seconds. 15. Approaching last 10 seconds now. Do we have an answer?
Charlie. It's Charlie.
So they want us to lock option C. Are you clear on that? Option C. I'm going to now lock option C, please. And
Why not?
very well done. Yeah, we have now gotten in a habit of scaring everyone, but that was the correct answer. Very well done. Yes, we have another match, went to the wire, and we have a draw. So since we all know it's the initial league stage, so we don't have any tiebreakers or any super overs at the moment, which we will have in the next stage of the game. And with this, we come to an end, and we definitely have a tie. And I think without much ado, I'm going to move towards our panel of experts. And first of all, Professor Hafizullah Saab. Sir, it's great to have you. So honored to have you with us.
हमजा साहब, हफीजुल्लाह साहब से बात भी कराइएगा, वो तो सब चीजों को कंक्लूड करेंगे.
Sir, sure, we can have you first. Sir, please, please.
I will just say, I'll congratulate both the teams for an excellent fight. And we will agree that the questions are very straightforward and good. And I am glad that for the first time I used my discretion as an umpire and equaled the score. So with this, I would like to take your leave and my best regards to all the distinguished colleagues on the screen, especially Professor Hafizullah Saab. Must be very happy to see P.I.C. Taking the 6 marks as a consolation. So thank you very much, and I leave.
Thank you very much, sir. It's always instrumental to have you, and as I think we know, you are extremely important for this game as an umpire, as a mentor. Thank you very much for your input. And with this, I now move towards Professor Hafizullah Saab. Sir, are you there?
So please,
can you unmute yourself, Professor Hafizullah Saab?
You keep on muting me, so I have to unmute myself. So
Sir.
Thank you very much. I think it was a very interesting game. I think S.I.C.V.D sub commented that I'll be happy for P.I.C. No, I'm not happy for P.I.C. for the 6 marks, but I'm very happy that we should uphold the sanctity of knowledge. What is correct is correct. That has to be appreciated. and that has to be recorded as well. Most of the questions were very well constructed. I think perhaps it is also a time that we should look at our questions more critically, and perhaps instead of one person developing questions, I think it should be a team of at least three persons that should be looking at questions and querying them again and again. There was another question of treatment of DVT. Again, should we go for low molecular weight or should we go for NOACs? Again, this is a question that we should be discussing. Since it has been answered, I will not go into details, but these are the questions that for the sanctity of knowledge, for sanctity of being correct as correct, I think we should look at these questions more critically. I'm very happy that Wilson has launched this sort of an ambitious program, and the way our moderator conducted it, it was absolutely nice. It was so nice to see Dr. Fawad after a long time as well in his role. He's always seen on the media for that purpose, but I sort of congratulate. My other question was that we have three persons on one side and four ladies on the other side. I think for three men, we need four ladies. Perhaps two would have been sufficient as well. But it's good to have equal number of participants from both sides. So I think next time we should make sure that 3 + 3, that should make it a good thing. And also another point that I would like to make over here, that when somebody is talking, the mic goes towards that person and the major screen, the primary screen goes away. So I think if we should remain in the same sort of context, that the screen should remain, we should be able to see the questions while the question is being answered. That will be wonderful. So thank you very much, Wilson, for offering us this chance. And it's great to see Firoz Saab, Ishaq Saab, Fawad Saab, and I can see somebody else as well. And congratulations to both the teams on performing very well. And I think the most enjoyable part of the whole thing was the discussion among the participants when they raised their hands up and down. I think that's the most interesting part of it. Thank you very much.
Thank you very much, sir. I think extremely valuable input. I think it's our mentors, our stalwarts who actually guide us all the way through. And again, I think as this process, this show is evolving and the input is going to be extremely essential. We have a review committee and the questions also go through scrutiny, and this whole process is improving every day.
Sir, with due respect, can I say something?
Yes, sure. Please go ahead.
Sir, unfortunately, one of our candidate was not present. Just to remind to Professor Dr. Hafizullah, that because his father was admitted in hospital yesterday, he was in very critical condition. So that's why we three were available over here.
All right.
Good job.
I think you guys have done a great job. And lots of prayers for him. We've just come to know about that. So, but I think you all have done so great. And now I will move on to the rest of the panel. We have Professor Fawad Farooq Saab, ever so instrumental and important for the show.
With every passing match, we not only improving on technicalities, but certainly excitement of the last match was very close, and this match was too close. And certainly, it's really things are going in a very right direction, and I'm proud to say that it's a joint venture, Pakistan Cardiac Society and Wilson is doing marvelous job in that sense, that they're really fine-tuning everything with every passing match, and that's a wonderful thing. And people like Hafizullah Saab, so busy and so honored, joined us for whole 1 hour. That's a big thing for this whole Super League.
It's victory for us already.
Yeah, and we hope more involvement across the country to this Super League for certainly improving knowledge, creating competition among the fellows, and certainly the question is standard in a way that we are not focusing just ischemia. That's a good part of it. You're taking different aspects comprehensively, so that will compel the fellows to read everything of cardiology rather than just focusing on intervention and ischemia. Over to Hamza.
Thank you very much, sir. I think Professor Abdul Hamid Siddiqui Saab, he's there. Sir, your input, please.
Yes, I think very good competition. We ended up with a tie, and Professor Ishaq adjudicating as umpire. So all went very well. Very practical question and good answer, and good good luck for both the team in further competition, and very good moderation again.
Thank you very much, sir. It's always a pleasure to be here, and I think all of us we wait
But
for this
Hamza,
day.
I would add one thing again that is noticed by Professor Hafizullah, and I'm saying it for last 6 matches, that when the question was asked, ideally that three window screen with big screen of question and team's small window should be on the main screen. Usually it happens when the question was asked, you put the team on the main screen and put your question on the smaller screen. That take the people who are here, although I know that on Facebook you have the main screen with question on the screen there. But ideally it should be here as well, that your question screen should be the bigger screen. Irrespective, whoever is asking question, they should be in the small window. I don't know why you are unable to fix this problem.
Okay, sir. So I think the technical team has responded, and they are saying that that needs to be pinned on the Zoom screen. So I think I'll also request the technical team to show it and demonstrate this whole procedure to the panel of experts, so that it becomes easier for them and they can get it their way, because they're absolutely right. I think they need to see that. It's important. So yes, I think they'll guide you on that, and they'll make it possible for everyone. So with this, I think I would now like to see whether we have Associate Professor Dr. Iftikhar Ahmed Saab. Is he there with us? Do we have him?
Yes.
Yes, I am here. Thank you very much for giving us a chance to participate in this Super League. This was our first match, and our candidates participated very well. Initial 1 to 2 questions were missed. I think they were overthinking, and that's why they missed some of the questions, but very well played. And we are hoping to get better marks in the next sessions also. And I congratulate both the teams. They played very well. P.I.C team also played very well. They missed some of the questions in between, but they get out of that scenario and came out very well, and very well played both the teams.
Very right,
And
sir.
best of luck for the next.
Thank you very much. I think extremely important for both the teams to prepare for the next game, and your team, and I think in fact both the teams, they actually did a wonderful job. So congratulations to them. But at the same time, I think now I'd like to ask Professor Javed Akbar Syal Saab if he's there. Sir, can we have your input, sir? Okay, so I think with this, we are almost towards the end of the show, and as we all know, the news from the center is, again, it was an extremely important match, and it was a close game in the end, and we have another tie, S.I.C.V.D Thunders and P.I.C Warriors. They have tied the game today, and I think this is going to make it even more exciting. I thank all the dignitaries, the panel of experts, and okay, so I believe that we also have another announcement to make, that we are going to have another game, which is going to be after the cardiology update. We were on the 12th June, so that's when so we are going to have another match. There's a slight change in the schedule, so instead of the next Saturday, we are going to have another game next Wednesday on the 12th. So with this, I think we are going to conclude today's game. I thank all of you for your input, and congratulations to both the teams. I think it was a wonderful game, and this is what keeps us going. It's not the victory or the loss, it's the competition which keeps us going here and also in our lives. With this, we move to the end. I thank you all. Inshallah, till next time, Allah Hafiz.